You are capable, you are powerful, you do not need permission. How does that feel in your body? For many of us, we do need permission. The power that authorities have over us is deeply ingrained from kindergarten, our teachers, to our bosses, to the government, the medical profession, and experts on any topic. Most of us, for most of our lives, have truly believed that someone outside of ourselves knows more than we do and is charged with acting in our own best interest. Dissolving this belief is the first step to informed choice and autonomy in birth. You are the boss of your birth. How could it be any other way? No one outside of you can really know what you're experiencing, feeling, intuiting, let alone weigh up which options are going to resonate most deeply with you and support the best interests of your family. It is scary and a big responsibility, but only you know what is right for you, and only you are in charge of what happens to you and your baby. We're all so unique, with different values and backgrounds and life paths. No system can make room for this. That's not the fault of the system, it's just not what systems are built for. In a system, if you want an option that is not delivered by a one-size-fits-all safety committee, you have to ask for it and assume accountability for it. This is the beginning of informed choice, because until you step into your own autonomy as a person and birthing woman, you will give your power away to people that you believe know better than you do, and you will get one-size-fits-all treatment that does not support your deeper desires and needs. With autonomy, it becomes your own responsibility to know and access your options of choice. It sucks that we have to advocate for ourselves as labouring and birthing women. But unfortunately, in our current system, especially if you transfer to hospital for any reason, it will be required, unless your wishes happen to line up with their protocol, which they might, depending on the situation that you're in. There are better and worse ways to access informed choice and assert your rights. This is my 6-step recipe. So step 1, learn about alternative options to standard protocols. Much of current medical maternity practice is not predicated on evidence, and much of our culture's views on birth do not encompass the full picture. Unless you do your own research, you may never know what some of the most beautiful, supportive, and powerful options are. Step 2 is assume autonomy in your pregnancy. Exercising your full right to choice in your pregnancy will give you practice noticing and perhaps choosing alternatives instead of going along with standard procedure. So you might have a completely autonomous pregnancy, like a wild pregnancy, and have no care provider at all and just do your own prenatal care, or it could mean that, or it could mean having a midwife and choosing everything that she recommends, but knowing that each thing is your decision and you're not just going along with the recommendation. And you'll start to notice how much stuff we just unconsciously go along with in our lives when we think that the stakes are quite low. And then if you do have a care provider for your pregnancy, assuming autonomy in your pregnancy will teach them before your birth, when the stakes are much lower, that all the choices rest with you. And so when they are at your birth, they'll already be accustomed to asking for permission and outlining all of your options. Step 3 is decide what is and isn't right for you on the big issues. And so induction, waters opening ahead of labour, breech, postdates, long labours, IV antibiotics, that's just a few. These are the issues that if you don't know what standard procedure is and what the alternatives are, they really do just go down their own track. So figure out what is and isn't right for you on the things that are likely to happen or likely to be recommended, and then let your whole birth team know what your wishes are, in particular your partner. So your doula or your midwife can only do so much in terms of creating conditions for advocacy. Decision making has to come from you, or possibly if you're incapacitated, as labour can do, which is why it's so annoying that we have to advocate for ourselves in labour, your partner or family members. So be prepared for this. Step 4 is practice the gentle art of asserting your rights. So the first half of this is attitude and not being adversarial. So appreciate that the people making medical recommendations also want the best for you. You just disagree about what that is. So framing things along those lines is useful. I understand and appreciate that you believe Y is the best choice because of your knowledge and experience, but we'll be choosing X. So don't make anybody wrong for what they're recommending. Just express that it's not right for you. Be kind and pleasant but firm, and communicate as fully as you can, or have someone do it on your behalf, and as in advance of the thing happening as you can. And so step 5 is be ready to fight if you do need to. Even though I just said asserting your rights is a gentle art, sometimes things move fast, and particularly in an emergency situation, people will do what they've always done and ask permission later. You might be fine with this, but if you're not, be ready to yell or have someone on your birth team use strong words or actions on your behalf. Many midwives and doctors have the view that if it is an emergency situation, you must hand over your autonomy to them. This is not true, and unless you want it to be, and it's not true unless you want it to be, and that's actually what makes you feel safest. Step 6 is practice saying, I do not consent. That is all you need to do to legally stop something happening to you that you don't want to happen, no matter how small or big of a deal it is. When it comes to your birth, there is no such thing as it doesn't matter. If it matters to you, it matters. If you still need permission, I am giving it to you right now. You are capable. You are powerful. You do not need permission.